Welcome to another exciting edition of your favorite program, Health Affair on AIT. On the program, we focus on critical public health challenges, issues of women and children, with a view to finding lasting solutions. My name is Oshuomo Danes, your host. Spine-related issues affect every group of persons, young and old. When a person is experiencing low back pain, neck pain, weakness in the arm, limbs or legs, they are all spine related. The fact that many people do not know much about this specialty and where to go for help makes the topic a major concern for our discussion on the show today. Please don't go away. We'll be right back after the news segment.
It was a workshop for health journalists, religious leaders, and various stakeholders in Lagos State on how to achieve more reduction in the number of COVID-19 recorded cases on a daily basis. Reaction to the arrival of the 3.92 million batch 1 Oxford AstraZeneca vaccines set the tune for the day's discussion.
But that is small. We have to vaccinate 100 million people. So we're going to get it in tranches. And before it gets to everybody, and before we can get what they call herd immunity, that is enough people that are vaccinated to prevent transmission, it's going to take a while. It will take at least a year to 2 years to vaccinate everybody against COVID-19. So
it's great that the vaccines are now starting to arrive. That was an enormous achievement yesterday when they arrived at the airport. However, there's 200 million Nigerians. It's going to take a long time for everybody to get vaccinated.
The arrival is of two dimensions. It's with mixed feelings. Well, it has arrived. We thank God. But how many of the dosages are there? We heard that it is the first consignment. When is the second consignment? To start with, before that, how far will the first consignment go?
Our concern is to find out ways and means of the distribution to ensure justice and fairness. If the vaccines are not enough, there are tendencies that it will also be to serve the mighty and the great, but that will not be the intention.
As the growing misconceptions and safety concerns about the vaccination, they urged religious leaders to speak with one voice.
Work together today to craft a message that can then go out to their faith communities across Nigeria. And I think that this interfaith effort is really the story of the day, because this is how we're going to make people safer across Nigeria until the day that they can be vaccinated.
First of all, for them to believe that COVID-19 is a reality themselves. Two, to circulate this message among their own congregants in their various places. To teach them also to believe that COVID-19 is real, and then to help them also practice the accepted protocols that will ensure their own safety and safety of others. When leaders do that, I think others will follow.
Faith leaders, we do our best to communicate the message. Pulpit managers, we do our best to send out messages. But it is dangerous when we do our best and government officials sabotage it. It is unacceptable where a state government, a state official, will organize program, bring people together. He will not obey COVID protocols. And I think that until something is done about those states and those state governors and authorities who are violating the protocol, we are not yet where we should be.
Saudi Arabia is now saying that there is no Hajj if you are not vaccinated. So if one wants to perform Hajj, they have to take the vaccine. This is with a view to protecting everyone.
It's going to assist us in the body of knowledge being put together regarding this COVID-19 virus.
We can actually do what they call genomic surveillance, so that we will be able to not just know different strains or variants, but also to see in which part of the structure that can be targeted either for drug development or for diagnostic, most importantly, and then for vaccination.
The importance of the next generation sequencing machine during the COVID-19 pandemic, according to health experts, cannot be overemphasized, with the ability of the COVID-19 virus to mutate, thereby changing its transmission dynamics to escape available vaccines and therapeutical measures.
The fact that you have taken the vaccine does not make you immune to the virus, but you have an assurance that if you get infected, it's not likely to kill you. It's not likely to result into death. Okay, so you're better protected, you're better covered with the vaccine. So that is why we say that having taken the vaccine does not mean that you let down your guard of keeping safe.
The new technology will not only serve in the molecular surveillance of COVID-19, but prepares Nigerians in the fight against Lassa fever, yellow fever, Ebola, and any other infectious agent characterized by the genetic code.
Sometimes my teeth used to eat me, and sometimes it's like they are giving me blood here. Government, please help me. I don't want to die in this condition. I don't know my parents.
The pain, the psychological trauma and crisis that this 19-year-old Jamiu Blessing is going through as a result of the malignant growth on her face is better imagined than real. For her and some kind neighbors who connected her to AIT, the International Women's Day celebration and life entirely can be regarded as worthless when there is nobody to fight for the cause of the helpless, especially in terms of access to health care.
She has been to the Lagos State General Hospital at Ikeja. They told her that it is cancer, but she's going to do test, scan, X-ray, and all those things comes with money. But as it is now, there is no change, there is no money with her. Sometimes she even starve herself from eating because she's complaining. Whenever she's chewing, she feels pain.
It's touching me when looking at her. I don't feel like seeing her in this condition.
Government should help, especially the poor people, to secure funds for the treatment of these people.
Apart from meeting the health needs of vulnerable women and children, women are also demanding for equal opportunities in other spheres of life, like their male counterparts, to make impact.
Involving them in policy making, in decision making, giving them a seat at the table, giving them a voice, removing culture barriers, removing barriers, things that will make them not speak, where you say, oh, a woman does not have a right to speak. That should be removed.
It is actually women who are nation builders. It is women who can make a lot of difference. You can see all the things happening around. The government has not bothered to call women to come to their aid. We're the mothers of these people, and there are ways that we can actually talk to them.
Welcome back. The spine specialty focuses mainly on treating spine conditions. Common specialists include physical therapists, orthopedic surgeons, neurosurgeons, pain management physicians, amongst others. Patients with neurological problems such as spine stenosis, spinal deformity, spine infections, vascular diseases, spinal cord injuries, and brain tumor require the services of this specialist. With a population of over 200 million people, there are quite a huge gap of these specialists to cater for the needs of Nigerians. The situation has further worsened with the migration of healthcare professionals for greener pastures. There is also the challenge of cost. This has driven many patients to seek help elsewhere to their detriment. I spoke with a consultant orthopedic surgeon and the chief medical director at the National Orthopedic Hospital, Igbobi, Lagos, Dr. Mustafa Alimi. Dr. Alimi will be telling us about the spine specialty, spine surgery, and lots more.
The specialty of spine is a specialty that covers conditions that affect the bones and the content from the base of the skull down to the sacrum and the coccyx, which is where you sit on. So any condition that affects the bones and the content, is the area of the spine surgery.
Who should visit a spine specialist or a spine doctor? Those who are watching will know the right place to go to.
Spine surgical services, the type of patients you see depends on what part of the country that you find yourself. In this part of the country, in Lagos here, we see a lot of degenerative cases, much more than we see accidental cases. We see a lot of accidents as well, but a lot of degenerative cases, people are growing older, thank God for that. They're becoming 50, 60, 70, 80. They're going to have back and neck issues that are going to affect their walking, their standing, so they have to present to the spine surgeon. Now you have, of course, spinal injured patients, whether it's cervical spine, that's in the neck, whether it's in the back, thoracic or lumbar spine, they are also part of our patients. Then we have patients who have spine infections, tuberculosis of the spine, in other infections of the spine, non-granulomatous infection of the spine, that also have to present to us. Then we have children, scoliosis, children who have deformity of the spine, that also present to us. We manage them both operatively and non-operatively as well. So it's a wide range, from trauma to infections to tumor to degenerative to pediatric, all in spine. We're talking about tens of thousands of patients who present to this hospital for spine-related issues every year. On the average, the clinic caters about 120 patients twice a week.
So you've been around the world. How would you assess our performance in Nigeria compared to what you've seen out there?
Quite frankly, in the past few years, our performance has been tremendous. Nationwide, Lagos, Ife, Ibadan, Enugu, Kanu, Abuja, they've grown in the services of spine surgery provision. And we've been able to handle quite a number of conditions that can be handled outside the country. We have two groups of specialists that are involved in spine. We have the orthopedic surgeons and we have the neurosurgeons. And we've been working together, and I'm sure most of the conditions that affect the spine can be handled locally in this country.
So how do you do it? What are some of the challenges you encounter in the course of your work?
Well, spine surgery, acquiring the knowledge. I mean, those of us that pioneered the practice locally had to acquire knowledge of spine surgery outside the country, and that was a little challenging. But now, as a concern, that's for all of us, we'll be able to provide the training, a reasonable part of the training locally. Now, the challenges of spine surgery basically is about equipment, support, infrastructure, both pre-op, intra-op, and post-op. With the improvement in some ancillary services, like for example, when MRI became something that was available in most parts of the country, it improved the investigation in spine surgery. Now, people are beginning to have the knowledge, and we are beginning to provide more services. A few of the big hospitals have been able to afford some of the equipment that are necessary to provide reasonable spine surgical services, but not all the hospitals are able to do that. So if we continue at this rate, I can assure you that in the next few years, we will be able to do what most parts of the world can do locally.
That's good to hear.
Another challenge that we have is spine surgical service, even though we're a government institution, it's not absolutely free. There are things that we can't provide that the patient has to provide for himself. If we start with the investigation, for most spine surgical patients, they're going to require an MRI. We are not the one that will provide the MRI. The MRI costs the region about 70 to 85,000 naira, depending on where the patient is doing it. The patient has to spend that money. That is the basis for which the patient will be reviewed. Then when surgeries are needed, you have components of surgeries. You have screws, you have rods, you have cages that are not our products, and it must be purchased, so the patient has to pay for them. Even though we are going to provide services free, but the materials that are going to be required have to be provided by the patients, and they have to be paid for. So those make it, it creates some, it adds some costs to the provision of the services for the patients.
You talked about the MRI. For people who don't know what MRI is, can you tell us more about it? And they're looking at the cost. Do you think, can't it be integrated into NHIS to make it accessible to people? Okay.
No. MRI is magnetic resonance imaging, and it's a special kind of imaging that images the casing and content of the spine reasonably well. There are other modes of investigations that we use for imaging the spine, but the MRI is a very important tool. Now, MRI is expensive worldwide. It's not about Nigeria. Everywhere in the world, MRI is not a cheap investigation, and it's not a kind of diagnostic tool that can be easily erected with a wave of a hand. There are states in this country that don't have MRI services, but I know for a fact that MRI is catered for to a reasonable extent in NHIS. I think about 50% of the MRI cost is covered by the NHIS for some MRI for some patients. So I know that the NHIS has covered some of the cost, but that does not make it any cheaper. If you look at it, 50%, 35,000 naira is still not what everybody can afford.
In an era where we have problem with manpower, migration of doctors abroad for greener pasture, what can we do to encourage more people to come into the specialty?
Well, migration of health personnel has hit everybody across board. Across board. Not just the spine surgeons, across board. And we are afraid because the system runs personnel in cycles. We came in, we were young, we are going to have to retire. And we are hoping that more people will come in for us to hand over the services to continue. So, I mean, we are all concerned across all subspecialties, either it's in orthopedics or not, because everybody is concerned that and the migration is heaviest amongst the youngest in the system. So we are afraid that the system will suffer the growth if we don't get replaced. Because, I mean, everybody has his own cycle. You're going to be in the service. You're going to do your best. Hand over. Medicine is rapidly evolving. What we think is the best practice today comes tomorrow as being archaic. So somebody must take it over. And we are hoping that we have people to hand over the baton to continue. We don't have enough spine surgeons. We have over 200 million population, and I don't think we have up to 100 spine surgeons in this country. So we do have a manpower shortage in that area. Now I belong to the Nigerian Spine Society, and we have been encouraging some of our younger ones because spine is not a basic subspecialty. You have to become either an orthopedic surgeon or a neurosurgeon first before you now come into spine. So you can imagine how many orthopedic surgeons we have, how many neurosurgeons, then how many of them will become spine surgeons. So it's not a basic subspecialty. But we are trying to encourage as many people as we can to come into the subspecialty so that we have more people that can reach more persons. I mean, more persons that can reach more people to provide these services for. We need to encourage more people to come into medicine. It's not just for us.
For a young student who is aspiring to become a spine surgeon, a neurosurgeon, what does it take? People want to be like you, they are watching you, they see you as a role model.
Yes, it requires a lot of hard work. Resilience is tough. But the fact that some people have done it, some are doing it, means that it is doable. What does it take? Become a medical doctor, first of all. Then come into orthopedics or neurosurgery for residency training program. It takes about 7 years, 8 years, 9. But when you finish, then you now start training for spine surgical practice. But it's doable. Some have done it, some are doing it, and they don't have two heads. There's nothing special about them. So if it can be done, it's doable, and we need them.
Thank you for coming on the show. We appreciate you.
Thank you very much.
Yeah. Let's take to our nutrition segment. The focus today is on pawpaw.
Pawpaw, also called papaya, are large oval-shaped greenish fleshy fruits that are grown in many parts of the world. They have a mellow taste and are greenish when unripe, with a hard pulp, and yellowish amber or orange when fully ripe, with a very soft flesh. Pawpaw plants grow in 3 sexes: male, female, and hermaphrodite. The male produces only pollen with no fruits. The female produces small fruits when pollinated. The hermaphrodite can self-pollinate since its flowers contain both male stamens and female ovaries. Almost all commercial pawpaw orchards contain only hermaphrodites. It is widely cultivated throughout the world, especially in tropical countries of the world, but its origin is in the tropics of the Americas, from northern South America through the Central America to southern Mexico. Because it is widely grown in many countries of the world, it is very popular and has diverse uses in many cultures. All parts of pawpaw tree, the seeds, the bark of the tree, the leaves and fruits are edible and are used in one way or the other. In traditional medicine, pawpaw leaves are used as treatment for malaria, as a purgative, and also used to relieve asthma. It is also used in many cuisines all over the world. The unripe green fruits can be eaten when cooked, but the ripe fruits is usually eaten raw. The black seeds of pawpaw are also edible, and they have a sharp, spicy taste. Green pawpaw is used in Southeast Asian cooking, both raw and cooked. In some parts of Asia, the young leaves of pawpaw are steamed and eaten like spinach. It is also very popular among the Filipinos, Indonesians, Brazilians, and Americans. In 2018, global production of pawpaw was 13.3 million tons, led by India with 45% of the world total. Global production of pawpaw grew significantly over the early 21st century, mainly as a result of increased production in India and demands by the United States. Raw pawpaw pulp contains 88% of water and also rich in carbohydrates and vitamin C. A 100-gram serving of raw pawpaw contains energy, 43 kilocalories, water, 88 grams, carbohydrates, 10.82 grams, sugars, 7.82 grams, dietary fiber, 1.7 grams, fats, 0.26 gram, protein, 0.47 gram, vitamin C, 67 milligram, 75% of daily value. Vitamin B9, 38 microgram, 10% of daily value. Potassium, 182 milligram, 4% of daily value. Magnesium, 21 milligram, 6% of daily value. Calcium, 20 milligram, 2% of daily value. Iron, 0.25 milligram, 2% of daily value. Manganese, 0.04 milligram, 2% of daily value. And lycopene, 1,828 microgram. Pawpaw skin, pulp, and seeds contain a variety of phytochemicals, including carotenoids and polyphenols, which are a dietary source of antioxidants that can reduce inflammation, fight diseases, protect against skin damage, improve heart health, improve digestion, and help keep you looking young.
On Health Affair, we'll give you a holistic approach to health education and care. So come with me to our clinic for tips on healthy living.
Cancer has been with us from time immemorial and will always be with us till we die. Detect them early. Be aware that cancer exists. Keep away from the things that are common in forming cancer. Too much alcohol, smoking, things like this are bad for the body. You should avoid them. It's good to eat vegetables. People talk about red meat and no red meat. Don't, in everything you do in this world, do it moderately.
The focus on Know Your Instrument segment today is on methylated spirit.
Methylated spirit refers to alcohol for general use that has been made unfit for drinking by the addition of 10% methanol and sometimes violet dye. Methylated spirit is commonly used in hospitals to sterilize medical equipment, to clean wounds, and lots more.
To participate on our perception segment, please call the numbers showing on your screen.
NAFDAC, they've done their due diligence and they have stood behind this vaccine to say that it is safe. So please don't say no to these vaccines. Take them.
This is where we draw the curtain on the show today. Thanks for spending your time with us. Please let's do it again same time next week. My name is Ushuomowa Daniels. Your health is your wealth. Please pay attention to it all the time.